Welcome to the Beverly Hills Plastic Surgery Podcast. No, I'm going to do that again. Can I do that again?
Yeah, start over.
I want to change that. I'm trying to think about the no big nose thing. Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today, here with my very normal-sized nose co-host, Dr. Millicent Rovelo. How are you doing?
I'm good. How are you?
I'm just admiring your normal-sized nose.
Why, thank you. It's a little big for my taste, but on average, I guess it's normal.
Well, the reason that I'm talking about big noses is because we had a patient, and this is the No Big Nose podcast, just in case anybody's wondering. They came in for a revision rhinoplasty, and they said, well, I know I need a revision. I just don't want a rib graft because the last thing I want is a big nose.
Oh, no.
Yes. So because the internet, in all of its wisdom, Dr. Internet. Yeah,
Dr. Google.
Dr. Google, Dr. Internet.
Gosh, that guy knows not a lot, but yet so much.
So much information that is just so wrong. The internet has convinced patients who are getting rib grafts that now they must have a huge nose.
That's unfortunate.
Which is not true.
And it's not true.
Just because you're getting a rib graft, hang on, I think we have a little, Sean, there's a disturbance outside. You're going to need to hold and, yep, there it is. Hold on.
Wait, it must be 5 o'clock.
It is.
5 o'clock?
As soon as we start doing this podcast, every ambulance needs to go past us. It's really important.
Okay.
Game on. The internet has convinced people that if they're getting a rib graft as part of their rhinoplasty, that they must have a huge nose.
And that's just not the case. That's not the case at all.
No. Just because rib cartilage is the donor site for the grafts that we need to do a revision rhinoplasty, it does not necessarily mean that the nose needs to be huge.
Well, I think there's a misconception because people, they don't know. They don't know what happens in surgery and what you're actually doing with that rib.
Right.
The conception is that you're, carving out a piece of your rib, their rib, which you are, and then just, sticking it on the nose.
Stuffing it in there.
You're like, all right, looks good, right?
That is not how it works.
That's not how it works.
So, reference the You Don't Know podcast, first of all. But second of all, look at what is done in a revision rhinoplasty. The idea is that you're going to undo the bad rhinoplasty and then build the nose and do the rhinoplasty that should make the nose look better.
Right.
And the graft material is incidental to that arc of progress in your aesthetic and functional aspects of your rhinoplasty.
But very, very critical because you need structure in that nose. You don't need it to be a big nose, but you need it to be able to hold itself up.
Correct. And just because you're using rib cartilage as the donor site doesn't mean you have to cut giant grafts.
No.
This is a huge misconception.
No. You're taking that piece of rib, and I'm sure you have plenty of videos on it, and you are carving it into very thin or thinnish or thickish, whatever size you need for whatever area you're putting it in. But you're carving it into the size that you need for that nose, and you're using it to make support and to make structure. But you are not using the entire piece of rib in one shot.
No, and that's a really old concept. So it's not totally unfounded. First of all, there are some people who use rib grafts and make huge noses, so we can't sit here
so there is that
and say that doesn't happen. I mean, I have people within, a half mile of here where we are right now that when they do revision rhinoplasty, the noses turn out bigger, and they like that.
That's what they want.
A problem. But this is why it always comes down to look at the before and after photographs of the operating surgeon. That's what you're going to get.
That's what you're going to get. And just because it's rib doesn't mean it has to be large.
No. In fact, if you look on my Rib-Graft Revision section on my website, there are some huge noses that were made with rib grafts that I then downsized using rib grafts. In some cases, new rib grafts, because I couldn't use the grafts that were in there. They were just not right for the job that needed to be done. So this concept has to get demolished. Somehow, we have to have patients not think when they hear the term rib graft that they have to have a giant nose.
No, because that's just not the case. The nose that they're going to have is going to be the nose that they see on the website, that they see in the befores and afters. And how you get there doesn't really matter, because that's what the outcome is going to be, and that's what it's about. But for these tricky revision cases, you need rib, and there's no way around that. You can't really do it with any other graft substitute. I mean, you can, but you're not going to get the results that you're looking for.
You can, and this is so the way that I got to. I'm going to use rib cartilage for the bulk of my revision rhinoplasties, and I don't use it for all. There are some that I'll do some ear cartilage. It depends what needs to happen, but when we're talking about structure and fighting scar tissue, it's rib graft or cadaver rib. Period. An allograft is fine. It works. It's a little bit different than using your own rib cartilage, so I prefer your own autogenous from the patient rib cartilage as opposed to something off the shelf from somebody who gave at the office, basically.
Yeah.
But the way that I got there is I used to think I was doing my patients a favor. They'd be like, "Oh, do you have to use rib?" No, I could probably use ear cartilage. Oh, that's so much better. Thank you. I'm so happy. Thank you. You're going to use ear cartilage. And then I would do the case with the ear cartilage, and a year later they'd be like, this really didn't work. I'm like, huh.
Yeah.
I should have used rib, shouldn't I? Yeah, I think you got to go back. So then I'd go back, and because of my revision policy, who's doing a rib graft on their dime? Right here, dude. Patient pays the OR and the anesthesia. I don't get paid anything. I do the rib graft. So after a few of those, I kind of said, you know what?
Just going to do it with the rib.
I'm just going to do it with the rib graft because I'm tired of fixing these ear cartilage fall apart. And that's the thing is it's like, it just depends on the result. Were the results terrible? No. But, they're not what I envisioned, and it's not what my patient envisioned. And, I just posted yesterday on Instagram a 2-year result on a rib graft for a patient that, and somebody criticized, oh, you put on-table results, they don't mean anything. And I disagree, and that's why I posted it, because I showed here's my before, here's my immediate on-table after, here's the 2-year after, because the patient was back for some airway stuff, and we were doing little revision stuff 2 years later. So, but the nose looks great, and it looks like the on-table result.
So
no. I think the on-table results count.
Oh, they for sure count.
I think they do, but I'm telling you, I get hammered at these meetings. Oh, there's on-table results. I mean, that's just good for Instagram. That's about it. And I'm like, no, that's not true. Maybe it is with your patients. Maybe your on-table results don't look like they look in 2 years, but mine do because I put a ton of structure in there.
And they hold up. Yeah, so they last. And that's the whole point. That's literally the whole point of rib, is that it gives you structure, it gives you support that lasts, that withstands the stress of time and scarring and warping.
Yeah, and you don't have to have a huge nose. You can cut the grafts small. You can cut them thin. Mm-hmm. You can put them in the right place. You can do all the things that you need to do to make a great looking nose without it being huge.
That is correct. Yes.
Should you want a huge nose,
we can do that too.
It's great to have a rib graft because then you got lots of material and you can make it huge. But you don't have to necessarily have a huge nose because you're using rib.
That is correct. I think we have made that point. Have we made that point? Maybe we should say it one more time.
No, I'm good. I think we got it. But I don't know how to change the internet, though, because these patients are like traumatized when they come in and to talk to us.
I don't know.
And it's a 45-minute conversation that's like, no, wait, you're just missing the point. Because you can use ear cartilage, you can use septal cartilage, you can use cadaver rib, you can use the patient's own rib. Those are your cartilage choices. But you can make the nose look any way you want.
But making it stay that way.
Yeah, that's why you need the rib.
That's why you need the rib.
So there you have it. All right, sports fans. I think that's all we got on the you don't need to have a big nose, no big nose podcast.
I think we got it.
Thanks.
Message received.
Then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.